Hello, judges, and thank you so much for giving me this opportunity. The title for my presentation is Identifying Prognostic Gene of Prostate Cancer and Exploring Their Expression Patterns Using Single-Cell Analysis. And my name is Junyue, and I'm from Miss Porter School. So, do you know about 1 man in 8 will be diagnosed with prostate cancer during his lifetime? And about 1 man in 41 will die of prostate cancer. Well, according to Global Cancer Statistic in 2020, prostate cancer is the second most common cancer among men and the fifth leading cause of cancer death. Last year, my grandpa passed away from prostate cancer, and it only took 3 months. And by the time we found out, the cancer has already spread and was very aggressive. So I was determined to dig deeper into such a horrible yet common disease and trying to find a better prognosis for it. After doing some research, I found out that prostate cancer is highly heterogeneous in biological behavior, with most cases are indolent and progress slowly, with only 10 to 15% aggressive. So the biggest challenge right now is to accurately determine whether the prostate cancer is indolent or aggressive to carry out individualized treatments. And the most important factors in fighting prostate cancer is early diagnosis and personalized treatment to improve prognosis. So I think it is very helpful to find reliable biomarkers to determine people with high risk, estimating prognosis and guiding treatments. And I did, and these lead me to this study to find the important significant prognostic genes, in which I did found 7 significant prognostic genes for prostate cancer, and that has never been reported before and could potentially be important biomarkers. And for this study, I chose to use single-cell RNA sequencing because it is unlike traditional methods like microarray and RNA sequencing, which use bulk tissue samples which contain a wide variety of cells, which might obscure biologically relevant and critical differences between cells. Single-cell RNA sequencing can sequence an entire transcriptome at the level of a single cell, and it can analyze the function of each single cell in the tumor microenvironment. Our study aims to first identify reliable prognostic genes for prostate cancer using single-cell analysis, and secondly, explore their expression in the tumor microenvironment from the view of single cell, and thirdly, study the significance of these expressions and in the occurrence and the development of prostate cancer. As for TME, it is the surrounding microenvironment in which tumor cells exist. And in the TME, other than tumor cells, there's also other cells and signaling factors. And the relationship between tumor and TME is like soil and seeds. So TME contributes to the formation of tumor heterogeneity. And for this study, we used 2 datasets. The first dataset is the microarray dataset, which studied expression profiling of prostate cancer. It is composed of 36 prostate cancer samples and 14 normal prostate samples. The second dataset is a single-cell dataset, which analyzed the transcriptome of over 36,000 single cells from 13 prostate tumor samples. And in order to reduce my computer load, I randomly selected 15,000 cells out of 36,000 without affecting the result. And then we adjusted the data for single-cell analysis using R programming. And here is my methods. And firstly, we use GO2R to search for differentially expressed genes of prostate cancer, and then I grabbed the heat map to visualize the expression of the DEGs. And secondly, we did prognostic analysis of the DEG using Wolclan. It is a website that can do prognosis analysis. And we searched for prognostic genes from the DEGs, and we verified the differential expression of the prognostic genes in bulk RNA sequencing data from TCGA. And lastly, we did single-cell analysis using Seurat packet and R programming. Firstly, we clustered single-cell and identified cell type, and then performed single-cell analysis on the prognostic genes. We are able to confirm the differential expression of prognostic genes and analyze their cell expression and the significance in TME. And here are our results. Firstly, we identified differentially expressed genes, and from the microarray dataset, we obtained over 54,000 genes using GO2R. And after statistically progressing the data by setting off the cutoff of p-value less than 0.01 and fold change less than 0.5 for downregulated genes, or fold change over 2 for upregulated genes. And then we got 1,667 DEGs, in which 520 are upregulated and over 1,000 are downregulated genes. And here is the heat map I drew to visualize the expression level of the genes. The one on the left is upregulated genes, and the one on the right is downregulated genes. And the red means high expression, and the blue means lower gene expression. And as you can see, these genes are very clearly differentially expressed. And next, we did prognosis analysis on the differentially expressed genes. And we chose to pay more attention on the upregulated DEGs because first, they are easier to identify, and they're also easier to perform gene function experiment on. Because for upregulated genes, we only need to knock the gene down or using CRISPR. But for downregulated genes, it must be overexpressed in tumors to study the gene function. And also, upregulated genes is a better choice as targets to develop drugs. And in the end, 7 out of 520 upregulated DEGs were identified as prognostic genes with a p-value less than 0.01. Here is the basic information on the 7 prognostic genes I found. And here is the prognostic survival curve for the 7 prognostic genes. And the blue line is low expression, the red line is high expression. And I observed that the high expression is associated with adverse outcomes, that is, shorter survival time and lower survival possibility. Here is the graph of the expression of the 7 prognostic genes in TCGA samples. The blue one is normal tissue, and the red one is tumor tissue. And I observed that all of them are upregulated and significantly differentially expressed. And from this graph, we are able to verify the significance of these 7 genes not only through microarray dataset, but also through bulk RNA sequencing dataset from TCGA samples. And then we did the single-cell analysis of the prognostic genes. Here is the cell clusters with assigned identities visualized by t-SNE. And we identified 7 main cell clusters. They are basal and intermediate cell, T cells, luminal cell, fibroblast, endothelial cells, mast cells, and monocytic. And t-SNE is a statistical technique used to visualize high-dimensional data. And in the graph, t-SNE 1 and t-SNE 2 represent the 2 dimensions. And here is the graph of the cell expression of the 7 prognostic genes in different cell types in TME of prostate cancer. We grabbed a dot plot for it to visualize the data. In the dot plot, the dot size and the shade represents the detected cells number and the average expression of certain gene in a cluster. The darker the color, the higher the average gene expression level is. And the larger the dot, the larger the percent of cells were detected with the appointed gene. And from this graph, we are able to see that all the 7 prognostic genes are mainly expressed in epithelial cells of tumor. Mainly luminal cells are the most, and then it's basal and intermediate cells. But there are also a small amount of expression in other cells in TME, such as T cells, mast cells, endothelial cells, monocytic, and fibroblast. And here is a violin plot for the 7 prognostic genes. And through the violin plot, we are able to reinforce the result observed from the dot plot. As you can see here, most of the genes are expressed mainly in luminal cells. And here is the feature plot of the 7 prognostic genes, which showed similar result. In conclusion, we are able to prove that single-cell analysis can be used to identify differentially expressed genes. And we successfully identified 7 reliable prognostic genes of prostate cancer, and their high expression are related to poor prognosis. And the 7 prognostic genes are mainly expressed in the epithelial cells of prostate tumor, among which luminal cells are the most, and then is basal and intermediate cells. And the reason why the 7 prognostic genes are associated with tumor prognosis is considered to be related to the biological behavior of the tumor itself. And by doing some literature review, I found that all the 7 identified genes have never been reported on the prognosis of prostate cancer before. There were only several reports on the expression of 3 out of 7 genes in prostate cancer, while the other 4 genes have never been reported on their expression in prostate cancer before. And we further explored the possible function and mechanisms of these genes and found that most of these genes were highly expressed in at least one kind of cancer, such as gastric cancer and breast cancer, and their expression were related to prognosis of the cancers. And so um, all these genes are significant and can potentially be biomarkers for prostate cancer and be used for creating treatments or medicine, or even potential therapeutic targets for prostate cancer. And right now, the prognosis for prostate cancer is not very good, and a lot of people even choose to get the surgery to have their prostate removed because they don't want to think about the possibility of getting prostate cancer. And so a big challenge is to find accurate biomarkers for deciding whether prostate cancer is indolent or aggressive. And my result could potentially help doctors determine the prognosis for high-risk patients and carry out individualized treatments. Well, however, my research are obtained purely from computer simulation, so to further validate the impact of these 7 genes on prostate cancer prognosis, we need to perform more clinical research. In the future, I wish to explore the possible functions and molecular mechanisms of the 7 genes in prostate cancer. And I also wish to explore the 7 other potential effects these genes have on prognosis in prostate cancer, because they are also expressed in small amount in other cells in TME, which play a key role in tumor progression. And I wish to appreciate Dr. Pingzhang Wang for his support and academic direction, and Dr. Martin Morrison and Dr. Chen for their data uploaded to GEO, and my parents for their support and encouragement during the research. And I wish to pay special tribute to my beloved grandfather, who died of prostate cancer within 3 months last year. And thank you so much. This is all for my presentation.